All right, let's talk about the clinical video station. You know, that one part of the exam that everyone seems to dread? But what if I told you that with the right system, this station can go from being a huge source of stress to your absolute best, highest scoring station? Well, that's what we're going to do. We're going to build that system right now.
I mean, that's the real question, isn't it? They show you this short, sometimes completely silent video of a patient, and somehow you're supposed to pull a full clinical picture out of it. It can feel pretty impossible. But the secret, it isn't some kind of magic. It's just having a repeatable, reliable method. And that's exactly what we're going to put together today. So here's our roadmap. We're going to break this down into 6 clear steps. We'll start by really understanding the challenge. What do the examiners actually want to see? Then we'll talk about the crucial prep work you need to do before you even hit that play button. We'll get into the viewing phase, and I'll introduce you to a really powerful mental framework I call the 4Ds. Then we'll cover how to structure your discussion. And finally, we'll build the single most important part of this whole thing, a completely rock-solid management plan. Okay, let's start at the very beginning. Look, to really crush the station, you have to get inside the examiner's heads. This isn't just a pop quiz or a memory test. It's a very specific test of your clinical skills. So understanding what they're looking for is the first step to giving it to them. It really just boils down to these 3 things. First, can you actually spot the signs? The subtle tremor, that specific rash, the exact grade of respiratory distress. Second, can you connect those dots? Can you link those signs together in a logical way? That's your clinical reasoning. And third, based on all that, can you create a management plan that is both safe and effective? See, it's not just about what you see, it's about what you do with what you see. That's where all the points are. All right, let's get practical. Your performance in the video station, believe it or not, starts before you even walk through the door. Those couple of minutes you have standing outside, that is not time for panic. It is a critical part of your strategy. A lot of the time, they'll have a single sentence posted outside the door. It might be something super simple, like fever for 3 days. Whatever you do, do not ignore this. A simple clue like that immediately gets your clinical brain working. It primes you to start looking for signs of infection or inflammation. It basically focuses your attention before the clock even starts. Okay, you're in the room now. You've got your paper, your pencil, and 3 minutes to watch the video. This is game time. Your focus here has to be absolute. Every single second is valuable, and how you use this time is going to determine the quality of your entire discussion. So here's your game plan for those 3 minutes. First thing you do, glance at how long the video is. If it's only 30 seconds, you know you can watch it 4, maybe even 5 times. Use that. Second, never ever finish early. Use the full 3 minutes to rewatch, to double check, to confirm what you saw. Third, if there are headphones, put them on. A tiny cough or wheeze could be the key to the whole case. And finally, write it all down. Everything, especially the numbers. And speaking of numbers, if you see a monitor and it shows an oxygen saturation of 94% or a heart rate of 150, you have to write it down the second you see it. Trust me, under exam stress, specific numbers are the very first things that will disappear from your memory. Writing them down makes them permanent and gives you solid, concrete data to talk about with the examiner. So you're watching the video, you're jotting down notes, but how do you organize all of this in your head so you're sure you don't miss anything? You use a mental checklist. And for this station, the most powerful one you can use is the 4Ds. Now, this is a really important point. The 4Ds are for you. This is your secret weapon. You don't say to the examiner, okay, now for my first D, which is dimension. No. This is your internal framework. It's your mental scaffolding that ensures you have a systematic and complete observation every single time. The first D is dimension. This is basically your general, big picture observation of the child's growth. Do they look small for their age? Maybe a bit overweight? Is their growth proportional? You're just starting with the basics of their physical development. The second D is dysmorphism. Now, this is where you really have to be looking closely. You're actively searching for any unusual facial features, any physical characteristics, anything at all that might point you towards a specific genetic syndrome. This requires a really keen eye for detail. The third D is devices. And let me tell you, this is an absolute goldmine of information. You need to meticulously scan the child and everything around them. Is there an IV line, an NG tube? What about a wheelchair in the corner? A nebulizer on the table? Every single device tells a part of that patient's story and gives you massive clues about their history and their current treatment. And the final D is distress. Now, this is so important. Distress does not just mean respiratory distress.
Is the child clearly in pain? Are they irritable, agitated? Or are they the opposite, lethargic, kind of listless? You need to identify the type of distress you're seeing and, if you can, grade how severe it is. This is what paints a crystal clear picture of the child's current state.
Okay, the viewing time is up. You've got your notes all neatly organized by the 4Ds. Now, the conversation with the examiner starts. And how you structure this discussion is just as important as what you actually saw in the video. So after you've presented your findings, this is almost always the very next question you're going to get. And it's a huge one. If you give a vague or disorganized answer here, you could really undermine all the great observation work you just did. You have to have a structure. And here is that structure. It's a simple 3-part approach. First, you're going to ask questions that help confirm what you think is the most likely diagnosis. Second, you ask questions specifically designed to rule out your other key differentials. And third, you always ask about potential complications of the condition. Following this shows the examiner you have a thorough, safe, and really logical thought process. And now we've arrived at the final, and I would argue the most important part of this whole station. You can spot every single clinical sign, you can ace the history questions, but if you cannot formulate a clear, coherent management plan, you will not pass. This is the ultimate test of your clinical competence. I want you to let that sink in. This is completely non-negotiable. Even if you stumble a bit on your findings, you must be able to present a management plan. This is what separates a competent clinician from a student in the eyes of the examiner. It's that important. And this is not something you just make up on the fly. You use a structure every time. You start with immediate stabilization, your ABCDEs. Then you decide on admission. Does this patient need to be on the ward, in the ICU, maybe in isolation? Next, you list out your investigations, and you follow that with your treatment plan. And crucially, don't forget to mention involving the multidisciplinary team. And finally, you wrap up with counseling for the family and any emergency plans they might need. That is a comprehensive, safe, and very high-scoring plan. Just one final tip here on your delivery. Don't just dump all of this information on the examiner in one long, panicked monologue. Present your plan confidently, clearly, but leave little pauses. This shows you're in control and it invites a dialogue. It allows the examiner to jump in with clarifying questions. It turns what feels like an interrogation into a professional conversation. Look, mastering the video station isn't about having a stroke of genius or just getting lucky. It's about replacing that feeling of panic with a solid process. From the moment you see that hint outside the door to the very last point in your management plan, this system gives you control and lets you show them what you really know. So, you have the framework now, the prep, the viewing strategy, the 4Ds for observation, and the structure for your discussion and management. All the tools are right here. The only real question left is, are you ready to use them to pass your exam, not just by scraping by, but comfortably?